Hello, girls. Hi, everyone. So I've been asked by my very, very lovely students to comment on, on the information gathering aspect of the OSCE exam. So is the people who unfortunately are not able to pass information gathering aspect, they somehow feel that probably it's not adequate history that they have taken from the patient. But let me assure you one thing, it's not about the quantity here, it's about the quality, okay? So whenever you don't gain, a pass in the information gathering domain, then don't start worrying about about the fact that you might have missed so many points. It might be actually the other way around, okay? Maybe you asked too much irrelevant information. Okay, so both the things would affect your information gathering, asking too little or asking too much. Okay, and asking too much is not advised because for so many reasons. One is that if you go on asking just a full history from each and every person, thinking that I will now not miss anything if I asked everything. But why is that bad? Because you don't always have time, one thing. Then you won't sound as, as a person who is like working at an ST5 level, because as I keep saying, ST5 level people, they're, trainees, they are like an evolving consultant. Okay, you don't want to sound like a medical student there. Okay, and you don't want to sound like somebody who is just sifting through all the information just maybe to be able to find something relevant. So that's not a good strategy. It doesn't give a very good impression. It doesn't even and it even affects if you ask details that are not relevant to the case, and you keep asking each and everything. It also gives a poor impression on the communication part as well, because it feels like it's not a smart communication that you are asking all the 200 questions that you'll ask everyone you are asking in that particular station as well. So that's not a good strategy. Targeted history is not something that I can say in few words. Everybody will need a grilling about targeted history, and that will vary based on the case per case. Okay, so it's not, I don't have any magic to say how targeted history, how can you make it just targeted. I can say that please think in your mind that while practicing, think that what information is going to be useful in this station. Okay, so but I won't be able to point out the questions because they will vary based on station to station, and that requires grilling, that requires a lot of practice, that requires good supervision, that requires good guidance. Okay, on an ongoing basis, and that is station to station. Okay, it varies. Now, for instance, you can, as a rule, imagine that I don't have to ask the irrelevant questions that are not useful in the station. But at the same time, I don't have to miss those questions that help me rule out the list of differentials that apply in this case. Okay, so for instance, if you know that if you know from your colleagues and from some previous students that this is the station, this is the diagnosis in our case, and you go right in your head, you've decided that I'm only going to ask these 1, 2, 3, 4 questions, and that's it. But that's again can really be a bad fail in the information gathering, because that only shows that you somehow knew the station, okay, or somehow guessed the station. Even if you didn't know, you somehow guessed, but you didn't go through the process of a smart ruling out of the differential diagnosis. So you would need to ask the questions that are required for ruling out those differential diagnoses. Okay, so in information gathering part, this is what I want to say, and I'm saying it because I was asked this question, and I'm saying it because I think this will help And if any further help will be station to station. So you need to be, you need, you know, like subject yourself to good practice, good grilling, and but targeted, smart grilling, not like, not one size does not fit all. Try to, don't try to, um, just imagine a list of questions that you will be able to apply to all of the scenarios. So this is it. This is just like a short clip to say that this is how you should approach. Let me know if it helps, and please keep focusing on your preparation. I hope you do wonders in the exam. Okay, bye-bye.